welcome back to the KCHC Podcast. Today we are going to be talking about dental emergencies. My name is Aaliyah Segura. I am a CDA here at the dental department, and that is my partner in crime.
Hey everybody, my name's Allison, and I also work in dental.
So today our guest is...
Hi everyone, I'm Dr. Milan.
So like I mentioned, today we are going to be talking about dental emergencies. We have a couple questions here for our guest, Dr. Milan, and she will give you all some information, something you might have known or something you don't know. So stay tuned and you're going to learn something new today. All right, so the first question is, what is considered a dental emergency?
So some of the most common dental emergencies are if you knock out your teeth, a broken tooth that's causing a lot of pain, a lot of facial swelling, or if you feel like you have an infection. Those are all dental emergencies that you should come see me.
I have another question. Can a toothache ever go away on its own? And if it does that mean the problem is fixed?
So sometimes a toothache can go away on its own, but that doesn't mean that the problem is fixed. So a lot of the times a tooth can be inflamed in your nerve, and the tooth can die, so the nerve dies, so it's no longer sending any pain signals to your brain. So even though you're not feeling any pain, there's still bacteria in that tooth and there's still infection. So it's really important to come see the dentist and call and get an appointment, because although you're not in any pain anymore, the underlying infection is still there. So your tooth may need to be extracted, or you might have to get a root canal. So make sure to call.
All right, I have another question for you. What should someone do if they knock out a permanent tooth?
So if someone knocks out a permanent tooth, it's really important to, if it's the full tooth that's come out, pick it up by the crown, which is the part you see, and you can gently rinse it with some milk or saline solution. Don't try to scrub the tooth or anything like that, because there's some cells on there that can help the tooth stay alive. And if you're comfortable, you can try to put the tooth back into its socket. If you're not comfortable with that, keep the tooth in milk and bring it to the dental office. But it's really important to come see the dentist 30 to 60 minutes after the tooth comes out if you can. If not, it's okay, but just try to keep it in milk, call. You can take some ibuprofen and put some ice for the swelling, but definitely try to get in to the dental office as soon as possible.
So in case somebody doesn't know, what is a saline solution?
That's just salt and water.
All right, what about if someone chips or breaks a tooth? Is that always an emergency?
So if it's just a small chip and you don't really have any sensitivity, you could probably wait like a few days, but it's still really important to come be seen, because that chip has really sharp edges and it can cut your cheek or lip. But if it's a really large chip or broken tooth, that you can see like a little bit of blood or anything like that, and it starts to swell, definitely come in the same day, because that means that it's probably the nerve is exposed. So it's really important, if you're having any pain, to come in, and that's definitely a dental emergency.
Okay, so what are signs that a dental infection has become serious?
So a lot of the times a dental infection can become serious if it doesn't become treated. So it's really important to come get treated. So if you have a lot of facial swelling and you have difficulty swallowing or difficulty breathing, it's really important to go not just to the dentist, but to the emergency room, because that means that the dental infection has spread to other parts of the body, and the swelling is causing you to not be able to swallow and breathe. Another thing is, if you feel like your swelling is going up to your eye, you also need to go to the emergency room for that as well. So definitely, if any of those things happen to you, that means that the dental infection has become more serious.
Okay. And the ER, if somebody were to go, let's say we're closed and they go to the ER should be able to at least help them, right?
Yes, the ER definitely can give you antibiotics, and that's definitely for more severe cases. So if you don't have any difficulty swallowing or breathing and you can get into the dental office, go to the dental office first. But if it's the weekend, and you're in a lot of pain, go to the emergency room.
All right, so there is sometimes this scenario whenever a patient comes in with excruciating pain, infection, swelling, and they want the tooth extracted that day. why wouldn't you be able to do it that day?
So when you have a lot of facial swelling or infection going on, it's really hard to get the patient numb. So when you use the local anesthesia, a lot of the times it won't go in to where, or there's like scientific reason, but the local anesthesia doesn't work as well. So when you are trying to pull out the tooth, the patient will always feel what the dentist is doing. So it's going to be really uncomfortable. That's why we usually send the patient to have some antibiotics for like a week and then have the infection go down before taking out the tooth. Another thing is that a lot of times when you do have infection, it's really hard to open up your mouth. So it's also difficult, you know, to use our instruments and take out the tooth. But it's really mostly because it won't be comfortable for the patient, you know, when the infection is there, since they won't usually get numb.
Yeah. All right.
All right. What if somebody loses a filling or a crown? Is that considered an emergency?
It depends on the situation for most people. If you're in a lot of pain, a lot of cold sensitivity, definitely come in. But if you can wait a few days, that's okay. Sometimes if it's like the weekend or something, you can go to the pharmacy and they have like over-the-counter filling material, and you can try to put that on your tooth because it does help with some mild sensitivity, but it's still important to come into the dental office.
Yeah. Okay. So what should a parent do if their child injures their tooth?
So if a kid injures their tooth, sometimes there can be a lot of bleeding, so I know it's scary, but you know, just try to put pressure over the area, you know, and help the bleeding stop. And once that's happened, you can also do a cold compress over the jaw or the cheek to help with the swelling. If it's a baby tooth that's come out, you know, don't try to put the tooth back in, just leave it out. If it's a permanent tooth, like we said before, you know, you can try to put that tooth back in and use milk as the solution if you want to just carry it to the dental office. But just make sure that, you know, just make sure that the child is okay. You can bring them over to the dental office because we still want to be able to evaluate the area and see what's going on.
Okay.
All right. When it comes to mouth guards, do they really make a difference in sports?
Yes, they definitely do. So a mouth guard acts kind of like a cushion for the teeth, so it absorbs a lot of the forces. So it really helps prevent, you know, knocked out teeth, chipped or broken teeth. So it's really important for like contact sports like hockey, basketball, football, yeah, things like that. But even like non-contact sports, you know, the ball could hit you in the face. So
yeah, that's
still
true.
important.
Yeah. All right. So how can an untreated dental infection affect the rest of your body?
So if it's not treated, it can definitely go into the surrounding tissues. So even though we were talking about how it doesn't hurt, that's why it's really important to get treated, because once the infection's there, it stays there unless it's treated. So it's really important to, you know, get a root canal, get that filling done, get that extraction done, because without having that treatment, you know, it can spread to other tissues in the body, spread into the bloodstream, and then it becomes more of a systemic issue. And, you know, you can start getting fever, chills, and then like we were talking about before, you might have to go to the emergency room.
Yeah. Okay. I feel like a lot of people disregard dental stuff, but it really does affect the rest of your body.
It definitely does, especially when it's not treated. So that's why it's really important to go get your routine checkups. And come to the dental office every 6 months, or, you know, every 3-4 months, whatever your dentist tells you.
Yeah, that's true.
I would say, what is one piece of advice you would wish every patient would know about dental emergencies?
One piece of advice is don't go looking up things on the internet, because sometimes, you know, you want to think things and then it gets worse and worse and worse when you're looking stuff up. So it's really important, just come to the dentist, we'll tell you what's really going on.
Yeah.
Don't just look something up because, you know, one small thing, it's probably not what it says on the internet. So just make sure to come see a dental professional, and don't believe everything on the internet.
Yeah, that's true. That's true. We never know what's true and what's not.
Yep.
How about this? Is there any final advice to our listeners?
So, final advice. I think I was saying this before, but it's really, really important to come to your dental appointments, but also brush twice a day, floss every day, If you have anything going on, like you feel like something's not right with your tooth, some mild sensitivity, always come check with your dentist, because it's better to get it done when it's smaller versus waiting and waiting, because it becomes a bigger problem.
Sure.
So it's really important to come in regularly, and if something's going on, don't hesitate to call, because we're always here for you guys.
Yeah, so y'all heard these questions, and I hope we answered some of y'all's questions that y'all had. We really enjoyed doing this, and I hope y'all learned something. Thank you. We'll see y'all next time. Bye.
See y'all here.